Okay, so 55-year-old female here for a platelet-rich plasma injection. This is her second one for chronic greater trochanteric bursitis of the right hip. She has severe tendinosis, in my opinion, pretty severe tearing to the gluteus medius tendon. I'm going to go ahead and do our ultrasound guided injection.
Here we're going in with a 3.5-inch 20-gauge spinal needle. You keep the stylet inside the needle so it can cut through the tissue better and quicker. Here we can see our needle coming in on the right side of the screen, basically trying to head right under the iliotibial band towards the apex of the greater trochanter. You want to get the needle tip between the gluteus medius tendon and the iliotibial band. May have a touch of greater trochanteric bursitis, which you can appreciate here. Her main issue is tendinosis and tearing of the gluteus medius tendon. Now we got the needle where we want it. We're taking out the stylet. And now we're placing the platelet-rich plasma. This is 10 cc's of leukocyte-rich platelet-rich plasma as well, somewhat red cell-rich from the Harvest kit. Here we're injecting the PRP. You can see it essentially separating the tissue plane between the iliotibial band and the gluteal tendons, including the minimus and medius tendons. And since the needle was essentially in a tissue plane between the iliotibial band and the gluteal tendons, the PRP actually flowed pretty nicely. I didn't get a lot of resistance as I was injecting it. So in this procedure, much of the PRP essentially bathed the surface of the gluteal tendons. Again, as you can see here, the PRP separating the tissue plane between the iliotibial band and the gluteal tendons. And after the injection was complete, I decided to fenestrate the gluteus medius tendon, which you can see here, essentially just going in and out of the tendon with the needle. Usually I do this part of the procedure before the PRP, but I don't think it really makes a difference. This helps stimulate mechanically the tendon to heal. It may also help the PRP kind of absorb into the tendon that's affected as well, as you're creating some openings within the tendon for it to seep into, essentially. And here you can see the tip of the needle within the gluteus medius tendon during this fenestration. Again, you want to pull back on your needle so you can redirect your needle while you're fenestrating the tendon. Otherwise, you'll be fenestrating essentially the same spot on the tendon over and over again. Here we are pulling out, and you can see this needle's a little bit bent. This is a 20-gauge needle, which I think is a good thickness for the needle. I wouldn't go any narrower than that, which may bend more and also more difficult to visualize in ultrasound.